Hello everyone, welcome back to Diagnose and Fitness, your go-to podcast for all things health and wellness. I'm Dr. Hamza, and today we are diving into the topic that affects millions of people worldwide: hypertension, often called the silent killer. To make this discussion more engaging, I have a guest with me today, Mr. Ahmed, who will help us to explore the topic from a patient perspective. Thanks for being here, Mr. Ahmed.
Thank you for having me, doctor. Hypertension is such a common issue, but honestly, I don't know much about it beyond the fact that it's about blood pressure. Why is it such a big deal?
What is the hypertension and why is it important? Great starting point: hypertension or high blood pressure happens when the force of blood pressure against the walls of arteries is consistently too high. Think of it like a pipe. If the pressure inside the pipe is too high for too long, it could burst or wear out. That's exactly what happens to our arteries over time.
Okay, but why is it called the silent killer?
Because it often has no symptoms, people can have dangerously high blood pressure for years without realizing it. Meanwhile, it's silently causing damage to vital organs like the heart, brain, and kidneys. Exactly, that's why regular checkups are essential.
So by the time symptoms appear, it's already serious. What causes hypertension? Is it something you are born with? That's quite a list. How does salt play a role?
Good question. Too much salts make your body retain water, which increased blood pressure. Think of it like adding more water to an already full bucket.
If there are no symptoms, how does someone know they have hypertension?
That's where regular blood pressure checks come on. Blood pressure is made into two numbers: systolic pressure, the pressure when your heart beats, top number; diastolic pressure, the pressure when your heart rests between beats, bottom number. Normal blood pressure is around 120 to 80 mmHg. Anything above 140 over 90 mmHg is considered high, and readings between 120 or 80 and 140 or 90 are considered hypertensions, but prehypertension, which is a warning sign.
Do those digital machines at home work?
They do, but it's important to use them correctly and calibrate them regularly. Always follow up with your doctors if you get a high reading.
What happens if hypertension isn't managed?
It can lead to serious complications, including heart disease, increased risk of heart attacks, and heart failure. Stroke. High blood pressure can weaken blood vessels in the brain, leading to strokes. Kidney damage. The kidneys rely on a stable pressure to filter blood properly. Eye problems. High blood pressure can damage the tiny vessels in your eye, affecting vision. Absolutely. That's why early detection and management are so important.
Wow, so it really impacts the whole body. If someone finds out they have hypertension, what's the first step?
The first step is making lifestyle change. There are some proven strategies. Healthy diet. Focus on the DASH diet, which includes fruit, vegetables, whole grains, and low-fat dairy. Reduce salt. Aim for less than 1500 mg of sodium per day. Exercise regularly. 30 minutes of moderate activity most days. Quit smoking and limit alcohol. Both are major contributors to high blood pressure. Stress management. Techniques like meditation or yoga can help lower stress-related spikes in blood pressure. Some do. Medications like diuretics, ACE inhibitors, or calcium channel blockers are prescribed based on individual's need, but they are often used alongside lifestyle change, not as a replacement.
Do most people need medication too? What about people who don't have hypertension? What can they do to avoid it?
Prevention is the key, and it's not very different from management. Eat a balanced diet, low sodium diet. Stay active and maintain a healthy weight. Avoid smoking and limit alcohol consumption. Manage stress effectively. Get regular checkups especially if there's a family history of hypertension.
So it's about making healthy choices early?
Prevention is always better than treatment.
Let's answer some quick FAQs before we wrap up. First question: can hypertension be cured?
Is hypertension the same as high blood pressure?
It cannot be cured, but it can be controlled with the right approach. Yes, they are the same thing. Absolutely. It's increasingly common in younger people due to stress, poor diet, and sedentary lifestyle.
They are foods that help lower blood pressure.
Yes, foods rich in potassium like bananas, spinach, and sweet potatoes can help, along with oats and beans.
How often should someone check their blood pressure?
At last, or least, once a year if you are healthy, but more frequently if you are at higher risk or already diagnosed.
Thanks, doctor. I learned so much today and I am sure your listeners did too.
That brings us to the end of today's episode. Thank you, Mr. M, for joining and asking such great questions. And thank you, listeners, for tuning into the Diagnose and Fitness. Don't forget to like, comment, and subscribe for more health focused discussion. Stay healthy, take care, and we will see you the next time.